All right, guys, we're going to get rolling. So we're going to kick off our 2025 healthcare initiative. Some of you guys may have already been introduced to this. Something that we rolled out at our Fitness Manager Summit just a couple weeks ago. It's Preston's initiative we're adopting. We're really excited to roll with here next year, but really it starts now, right? Our success stories at the beginning of next year are going to be who we engage and get started getting off the pharma treadmill and hopefully on our treadmills here this month and through the end of the year. So to share some objectives for today, is first sharing our mission, like I mentioned, to liberate 2,025 people off chronic prescription medications this coming year, to embolden and position trainers as the primary healthcare professional. We're going to share a little perspective on that today, understanding the current state of the union and what we're up against. Ben's going to share on that, and then becoming authorities on understanding chronic disease, how to cure it. We're going to provide some resources for you to start. Right, it's not a comprehensive guide, but hopefully it just jumpstarts your learning journey on becoming better professionals. And then we have an example of our average patient who's coming into our doors. Tiger's going to share on that today. So that said, Ben, I'm passing to you, sir.
Sweet. Ooh, a clicker. Just this one. Yep. All right, cool. All right, guys, we got a handful of things. I think this will help you guys with the perspective of actually what's happening currently and where we're trending towards. So first one, in 2021, we spent almost 18% of our GDP on healthcare. So, and there's a couple things to look at that. As a nation, our GDP is actually quite large, even larger than a lot of these other countries are referencing. And then we're spending twice the average of the other 38 high-income countries. So we have a higher dollar amount, and we're spending a higher percentage. And I've got some charts I'm going to show you here in the meantime, and the trend line is actually kind of insane. And then getting maybe a little bit more local in just Kansas, we currently rank 12th in the U.S. for adult obesity, with an obesity rate currently of 36%. And again, that was last year. We've been trending upward. I'll show you guys some graphs. I think we'll move it in perspective. I think we all know, is obesity good for us? No. And I think everyone would agree with that. I know this is, socially accept yourself. I think we can start to swing that pendulum the other way of like, hey, it's not okay to be unhealthy. That's not fine. And I think that needs to be our verbiage moving forward. We have now seen the average American lifespan decrease, and it continued to decrease for the 10th straight year. 10th straight year of decreasing the average lifespan, okay? And it's almost directly correlated into obesity rates. There's some other things that can be factored in. We'll look at that. The crazy part is this is not rocket science to a lot of us, but again, the leading causes of death are heart disease, followed by cancer, stroke, respiratory, Alzheimer's, and diabetes. Most of these are extremely manageable or very preventable if we're proactive in our health, okay? I've got some interesting things on mental health. That seems to be a very popular thing that is being talked about. I know a lot of you met with members and clients, and that's one of the reasons they're getting into fitness and exercise. I mean, who doesn't feel better after a workout? We were just talking about that the other day. I was really tired, but I got a workout. I was all jazzed up, and I felt great the rest of the day. Whoa. Was that crazy to figure out? No, we all know that. So let me show you a couple of charts I think that will, there we go. This is our trend of where we're heading towards in 2030. 2030 is 5 years away, guys. It's not that far. I shared this with my team. I think it's pretty eye-opening. When you look here, everything you see here that's kind of black, that is 50 to 59% of the population is obese. Not overweight, obese. Red is 40 to 49, and then you see there's only one state that's less than that, orange in Colorado, and that's 30 to 39. Okay, that's not great. We know as obesity increases, causation for risk factors increases, or more likelihood of being sick or being able to prevent that is going to decrease. So that is a very, very near future for us. That's 5 years away. Is your clicker broke, or am I not using this right? Is it there? Okay. We talked about health and mental health, if you will. This is percent of U.S. anxiety prevalence. Look at ages 18 to 25. So this is 2008. There's not a single age range that's really above 8% there. We're already trending towards almost 20, actually it's at 20% now in 2024. This cuts off at 2020 there. Ages 26 to 34, also seeing a pretty massive rapid rate there. The only one that's not really increasing is ages 50 plus. They've had, actually, funny enough, an 8% decrease. They just don't care, I guess, anymore. But look at 18 to 25. That's really funny. 139% increase since 2010. Okay, that's pretty nutty. All right, so I mentioned I have some charts to kind of put it in perspective. On the left, you're going to see life expectancy in years versus our health spending per capita. We're nearly double or even triple a lot of these other countries in what we're spending. And then if you look at our average lifespan, we're substantially lower. That doesn't really make sense. How are we spending more money, but we're getting less out of it? So we feel like there's something broken there. Okay, and we're going to go into the how we're going to do that. This is kind of more like the why we have to be the leading cause for change. Look at since 1970 how we've trended and how much money we're paying, and then you see the decreased line down, and look at how far off we are from these other countries. Now, what's also kind of crazy is you are starting to see a lot of other countries are also starting to see a slow decline in life expectancy. It's starting to trend that way. A lot of them have adopted some habits and some things that we have done, and we'll dive into that a little bit later. Next one. It's for the kids. Who was eating the Arby's? Is this you? As a kid? I'm just kidding. All right. So I put down on the bottom left is your trends in diagnosis of anxiety, depression, and or behavioral problems among adolescents 12 to 17 from 2016 to 2023. You can see almost nearly every single one is mostly going up. This is like any mental health. We talked about anxiety, if you will, there. Depression rates, increasing as well too. And then over here on the right, you're going to see the light blue is your ages 6 to 11. The dark blue is ages 12 to 19. We start late 80s to early 90s, all the way till today. You've seen it basically double in the percentage of U.S. children who are actually obese in these selected periods. So now we're seeing at a younger age, they're getting larger, they're getting more and healthier earlier. So obviously there's a root cause there, and we need to identify that. Now I've got two more slides I'm going to go. This is the pharmaceutical market size. On the far left, that's 2023. This is where we're trending to in 2033. This is in 10 years from now on the trends that we're going to. And this is in US dollars in billions. Going to go from 1.5 to 2.7 in the next 10 years. So what does that scream to you? We're going to get fatter, and they're going to write more scripts. Okay? I have a couple of clients that are pharmaceutical reps. Okay? When doctors go to prescribe, they play favorites. Guess what? They get paid off of what they prescribe. That's why my girlfriend, she works at Cancer Center of Kansas, and she's the main scheduler for the doctor. You wanna know what they do? They load that bitch up. They make sure it's every 5 minutes they have someone coming in. Is our quality of care gonna go down to that? There's no way you can dive deeper into root causes of problems. So they're handcuffed a little bit there. And then you have, hey, we're only going to go with these people that are paying us extra for these drugs to write. Maybe that one's better, but I get paid more for doing this one. That's a reality right now. You're seeing it in the trend line. Okay, next one. Getting all pumped up. This is also interesting. This is primary care physicians' average income over the last 10 years. Do you see a correlation? Do the charts look the exact same? Obesity goes the same rate. Pharma drugs go the same rate. Doctors make more. We are getting less lifespan and less quality of life. This is broken. Everyone agree? Make sense? Okay. I think that's all on that slide. There we go.
All righty, guys. So in order to position ourselves as a new primary healthcare provider, I think it would be useful to first define, or at least come up with a good definition of what it means to be healthy. So anybody want to take a stab at it that isn't looking at your guide? If you ask maybe one of your clients as a physician, you ask them, well, what does it mean to be healthy? I know you're treating a lot of sick people often, right? So you're trying to get them healthy. Does that just mean that they're not sick? Is being healthy just an absence of disease? Any thoughts? Brave souls? Okay. If you look in your guide, a scientific, something that's objective, something that's measurable, and something that's effective as far as the definition of health. If you can imagine your work capacity, your ability to live life at a high rate, produce power, right, produce work on an x-axis, and you look at duration of effort as a y-axis, okay, you can literally plot someone's health, someone's fitness. We can also look at prolonging that over a z-axis or over someone's entire life, right? You guys can see that chart on page 2 in that guide there. Have any of you guys seen that before? You think your doctor would tell you that that's the definition of health if you were to ask him? Or they give you something like that World Health Organization definition there? It's a sense of well-being, right? When you ask the average American, are you in good health? You know what percentage of people say that they are?
80%.
71%, very close. If we look at an absolute measure of health and fitness, right, of work capacity over broad time and modal domains over a lifetime, what percentage of Americans should actually be able to say that they're in optimal health? 2.7%. Yeah. You guys see that there's a crisis of clarity, and a lot of that is just in our operational definitions. Because unfortunately, our doctors are trained to treat symptoms and to treat conditions, not necessarily cure somebody through behavioral means. Okay? So when we think of chronic versus acute conditions, what's the difference between those two things?
Chronic is long term, acute is now.
How do you cure a chronic condition? So hypertension, cholesterol, diabetes. If someone takes Lipitor, right, does that cure them of their chronic condition? No, it just treats symptoms, right? If you're got shot in the foot, right? You have an acute issue, Gary, I'm pointing at you. If you shot yourself in the foot, right, and you have to go to the doctor, right, they're going to treat you because that's an acute condition, right? If we equate this to like a pool example, right, you need a lifeguard to come in and save you, right? You don't need a swim coach. If we think of this, what we're doing, right, and our initiative moving forward, trainers are swim coaches, doctors are lifeguards. Does that make sense? So if chronic conditions are behaviorally driven, they have to be behaviorally cured, otherwise they're medically babysat. When we look at chronic conditions versus acute conditions, where do we spend the most amount of money using those stats that Ben shared? 86% of our healthcare spend goes to chronic conditions, things that can only be behaviorally cured, which kills more people. Chronic conditions account for 80% of all deaths, okay? And they make you more likely to die from any other cause of death. Which can doctors actually cure? We talked about acute conditions only, and how our chronic disease is cured through behavior, and that's where you guys come in. So when we look at the personal training stigma, in my opinion, we get what we demand and we encourage what we tolerate. Sometimes we're often our most worst enemies when it comes to this career path because we don't treat it like it's a career for the best and the brightest, right? Someone who's fighting a problem that might be our greatest problem in our age, right? In our country for sure, as Ben shared. So we want to position ourselves as authorities moving forward. That's going to come down to mastering the material. So resources like these chronic conditions guides are just a start. I'm going to quick preview through that here in a second. And of course, we'd love a contribution from anybody in this room to expand on this so that we can all get better together. So this chronic disease guide that we put together, just to give you a structure of it, it begins with some operational definitions like we just shared and we defined health today. Goes through the differences between acute and chronic conditions. I would share this with your clients. And also overviews medical and behavioral interventions. There is then a condition-specific section on each of the 10 most common chronic conditions, and then also lists out additional 20 to 30 that are additional comorbidities beyond that. It's going to give you common medications that you're going to hear from your clients to where you can become an expert on those as well, right? Not just list them out as they tell you all the things that they're taking. You can now reference this guide and see, oh, I now know what that's used to treat. I know what your underlying issue is, and I know your fitness targets to get you off of that medication. It has some example fitness tests and progress tracking, which we're going to get into in our directive section, and then also some progression plans. So I wanted to highlight this piece. It's going to be after that specific chronic condition section. Just going through the individual cost of accumulated comorbidities, which is diagnosable chronic disease. Tiger's going to touch on that in his example today. Now, the average American, who here has health insurance, right? Either through your parents or through the company, right? Your average premium right, is about $4,000 to $5,000 a year. And that goes towards your preventative care, your routine medical services, and your premiums, okay? Now, this is where it starts to really add additional cost. Okay? So if you're an individual that has high blood pressure and high cholesterol, that's two comorbidities. Likely you're also on the path towards more comorbidities, but that's an additional $2,000 to $3,000 a year. Okay, so the total healthcare spend for that individual would be $6,000 to $8,000 a year. Now, this isn't something that most people will do without, and we're definitely not recommending anybody do without, right? But imagine if they spent that extra $3,000 to $4,000 a year working with you instead. Do you think their quality of life would be any better? You think they'd have more years at the end of their life as well? Right? So I would share this with your clients, and this is going to be part of one of our directives at the end, is totaling up what is my total sick care spend for my client roster right now? And how am I making an impact on that through our 2025 initiative? So here's the all-cause mortality effect by number of comorbidities. So those that have two comorbidities have an average of a 25 to 35% increase in higher all-cause mortality, right? So two people get in a car accident, right? The person with more comorbidities has a 25 to 35% higher mortality risk, right? You shoot yourself in the foot, right? You have an extra 25 to 35% higher all-cause mortality risk, right? So that's, if you get a disease, COVID being a great example, you have a genetic predisposition, having more comorbidities puts you at a higher risk of death. Car crash, significantly higher chance of all-cause mortality. We have senior clients that fall down, break a hip, and that's a life sentence, right? The fitter they are, the more hedge they have against death in those circumstances. They get bit by a snake, we don't have to worry about that all that much, right? But that's the cost when it comes to years of our lives. How long does it take to reverse comorbidities with lifestyle intervention? I would share this with all of your clients as well. If you have 1 to 2 comorbidities, that's often reversible in 6 to 12 months. I mean, we've seen blood pressure in as little as 45 to 60 days. There's others that are a little bit faster than others as well. If they have 3 to 4, typically takes 1 to 2 years. And if they have 5 or more, it typically takes 2 to 5 years of lifestyle intervention and professional support. That's you guys, right? Is their doctor going to come in and hold their hand to come and go to the gym 3 days a week? Or talk to them about their diet and actually check in with them on a regular basis? No. All right, Tiger, here's your example.
This is Aaron. All right. You guys feeling this right now? You get a little fired up yet? No? Not yet. I can tell. You guys are quiet. I get a little fired up when I think about this stuff because I think about the people I know and the people I care about, and that makes this important to me. I think about my future children. I'm like, man, I don't want them living in this world. So I felt like Andy and Ben, they got slacks on, I got shorts on. They're gonna give you guys some really high-end, crazy stats. I wanna make it really real for you guys and just give you an example, okay? So I took all their stats and I gave you your average person based off those stats, okay? So this is Wilbur. He's not a happy guy. Andy said earlier he's kind of got man boobs, so, he's upset. Okay, he's 35 years old, he's 5'9", 200 pounds, 28% body fat. Sound like somebody you know? I would hope so. It's the average person in America. So we just pluck somebody out. It's Wilbur. Okay, he's got 4 comorbidities. Okay, 50% chance he has depression. 40% chance he's not married. He makes around $65,000 per year. Just letting you guys know who he is. Okay, $18,000 of that $65,000 he spends on non-essentials. Maybe we have a spending problem in America too. Okay, but just frame. Give you guys some frame. Okay, so let's talk about Wilbur and his life. Okay, so Wilbur, he's tired. He's overweight and he's single. Okay, he's trying to make a difference. So he's going to go join the gym. He joins Planet Fitness. How do we feel about that? Come on, they're purple too, right? I'm just playing. Okay, he does random amounts of cardio that he hates. See how sad Wilbur is? Okay, he's not happy. He continues to eat addictive foods that the tobacco market bought up and made really addictive, so you can't stop eating it. He goes to the gym for the first 2 weeks, but he never interacts with any sort of fitness professional. They ignore him because they're focusing on their 10 clients they have from last week, or they're focused on their Instagram page, trying to grow their following. He writes off exercise as a possible solution. He's like, you know what, this is nonsense, this just doesn't work. I'm not doing this. Okay, so Wilbur's like, you know what, I'm gonna go see old Doc. Wilbur got really old for a second, I apologize. Okay, so his doctor his doctor is a greedy guy. So he hears 4 comorbidities and he thinks, dang, I just grew my income 4x. So he gives him 40 medications. His healthcare / insurance cost goes from $7,000 a year to $14,000 a year. So he spent an extra $7,000 a year. Side effects, he gets the constant cough, dizziness, upset stomach, low vitamin B12. He has random muscle pain. He's got liver problems, nausea, diarrhea, low blood sugar. Okay, remember that person you said you knew that reminded you of Wilbur? He's not doing too good. Okay, he's still depressed. He potentially loses his job because he doesn't do anything when he's there because he's too overweight and he's too tired. He potentially loses his marriage because he's not attractive anymore. And the doctor solves some of his symptoms, but he never actually solves the cause. He doesn't even recommend looking at the cause because he doesn't get paid for that. He's not incentivized. Okay? So Wilbur gets on Ozempic. He gets real thin, real skinny. Okay? He's still at risk for heart disease.
Did you hand draw these?
No, I use AI. Okay? Mental health issues don't improve. He loses 60 pounds, 30 of it being lean body mass. Raise your hand if you know what lean body mass is. Thank you. That's a good sign. Okay, he falls, tears his ACL because he's got no lean body mass, so he's just susceptible. Then he spends another $6,000 there. He gets prescribed more medications to deal with the side effects from his previous medications. Okay, so he's like, Doc, I got all these problems. I keep going to the bathroom when I'm trying to work. They fired me. He's like, here, just take this. It's another medication for you. Okay, and he says to himself, I just can't catch a break. You guys ever hear clients say, I just can't catch a break lately. I'm just always hurt. I'm always sick. Something's always wrong. I always have clients tell me this or members when they join. Okay, he gets his foot amputated from type 2 diabetes. That happens every 12 minutes in our country, by the way, if you didn't know. Okay, that's an inside joke from our West Central staff. Okay, so what happens is these people get stuck on this constant cycle, right? They get super overweight, and they're sad, okay, and they're doing bad habits, so they go to the doctor and they spend a bunch of money, and then they get all these medications. It doesn't actually fix anything, and then they're sad again, and they're still doing bad habits because we don't do anything to change their behavior. So they go back to the doctor and they give them more money. And it's this crazy cycle, right? And we believe to ourselves that this just happened by accident. You guys think it happened by accident? Of course not. Follow the money, right? Okay? Somehow, some way, somebody allowed this to happen. In our country, our own people doing it to your parents, your children, your cousins, your brothers, your siblings. I have a sister who's overweight who's been a part of our program before who still hasn't fixed that. Okay, but this happens to real people. So I know I made it funny. That's because I can't talk in front of a crowd unless I'm laughing. Okay, but you guys know somebody in your head who's probably going through this cycle over and over and over and over again, right? Can you guys all think of somebody in your family? Raise your hand if you've had that hard conversation with them about it. It's a low number of us that just raised our hand. And most of us didn't raise it all the way up because we didn't really have that hard conversation. What we want for you guys is to walk away today empowered, not only knowledgeable, but aware of what's going on, and so knowledgeable and so aware that when you go have that conversation, you have enough conviction and belief that you translate that onto your family, friends, clients, etc., and we actually start to make an impact here. Because if we can't convince our friends, family, etc., how are we going to convince anybody, right? But that's our job. So that's what we're here for. That's all I got.
Thank you, sir. Poor Wilbur.
Wilbur's sad.
Wilbur's sad. All right, guys, so we're going to finish up with some directives, some incentives. What do we do moving forward? So what we'd like for each of you guys, and your fitness manager is going to work with you on this activity, is we want you to take your client roster and we want you to add your drug roster, right? So for each of your clients, what prescription medications are they taking? Hopefully you know that already, right? But if not, you should definitely ask them, right? And then use your guide and become an expert, right? As a belief exercise, what I'd ask for you guys as you do that activity is what's the total cost to my client, both in financial resources and also in years, that is negatively affecting them, right, by them staying on that farm and treadmill. Now, our ask for each and everybody in this room is to pick one person that you're going to commit to getting off chronic disease medication by the end of this year. I mean, if you commit to this process, I'm sure many of you are going to help a lot of people get off that farm and treadmill this year, right? But my ask for each and some of you guys that have maybe trained the same people for 10, 15 years, they're going to be a little bit more resistant, is just pick one, right? We felt like that wasn't an unreasonable ask. You're just starting out, okay? Now, we're not going to be able to move the needle in Wichita alone. So our ask is anybody that you either choose to help or choose to zero in on, they help refer to other people that they probably know of similar lifestyle, have similar conditions that we could also help and team up with. Wichita was ranked second most unhealthy city over 100,000 people. Right, we're not going to move the needle just training our current active client roster. So our ask is to engage other people in this mission. They might not also refer other clients, but maybe they'll refer other mission-driven professionals into this career as well. Okay. Last, we ask you guys to keep track of client progress. Okay, we're going to give you guys a couple tools to do that, some things that we have some measurable results on in the past. So I'm going to give you guys quick 3 tiers of different fitness testing. The first one is just going to be an example of how somebody can compare to past personal results. Okay, so I'm going to show you guys a linear example. I'm going to share with you guys what we call a normative assessment, where we compare to fitness standards. This is something that we did at West Central pre-COVID, where we had about 300 people over the course of the year that we did this initiative with. I'll share some of those results, and then I'll also share how we would absolutely test someone's fitness and health. Okay, most of you guys are going to write that off, and that's fine, but I want to make you aware that it exists. I think having precision is good. I think having sophistication is good. I think it elevates what we do as a career, and hopefully you guys are emboldened by all this information that we're sharing today. So this would be the most simplistic form of progress monitoring that we would encourage you guys to use with your clients, or just your one person that you pick, where once every other week, you guys weigh in and measure body fat percentage. Is that crazy? We get what we focus on, and we get what we measure. Once a month, you check VO2. Easy enough? Okay, and in that guide, there's 3 different tests that you can use to measure VO2. I would encourage treadmill, because I think it's the easiest, but there's a bike and rower test in there as well. Okay, and then check every 2 weeks. Do I need to adjust their nutrition targets? Do I need to adjust their training frequency? And am I going to do any other tests for that individual? Pretty easy. I would imagine if we did just this consistent cadence of testing, we're already going to help people get off that pharma treadmill. And we don't even need any more complexity than this. If you want more complexity than that, it exists. There's a full example in your condition guide of something that we've used for years called the RBT Fitness Score, where we compare someone's biometrics at their current state to given standards. We compare their cardiovascular fitness across different energy systems, and then we measure their strength, both muscular endurance and absolute strength, okay? And then we score them, and then over time, the more fitness we create, the greater hedge we create against sickness. This was that example from 2019 at West Central. We had about 250 to 300 people where we did that full RBT fitness score once a month or once a quarter. And what we saw over the course of 12 weeks, just keeping track, okay, I didn't, some of you guys at that time can attest to that, Maddie, Gary, Tiger, right? We didn't dictate any programming to the trainers. All we did was have them test, okay? And what we saw over 12 weeks, we saw a 30% fitness improvement, over 6 months, 70%, and over 1 year, 150%. Now what we found is anybody that scored higher than a 50 were not on any chronic prescription medication for like the most common chronic conditions: blood pressure, cholesterol, diabetes. As soon as they got over 50%, that was gone, okay? Even thyroid, right? A lot of the ones that you're gonna see in your packet there. This, I didn't put a test in your packet because it's gonna be too complicated, but if anybody's interested in that, we have thousands of data points that we can measure and look at as it relates to someone's current power output over time, and then also putting that over a lifetime, okay, to really determine someone's absolute measure of health. I put some minimum standards and recommendations on here, okay, you guys can read that, right, but I would review these with each of your clients. These are our minimum standard recommendations for health, right, for moving the needle. We need to make sure that we're measuring your progress. We need to make sure that we're hitting our bare minimum metrics when it comes to nutrition. We need to make sure that we have progressive resistance training at a high enough frequency to where you have 8 to 10 working sets per muscle group per week. Great tool for helping with frequency. That they had at least 150 minutes a week of intentional aerobic exercise, over 60%, and they're getting 7 hours of sleep every night. Easy checkbox items. How you want to put that together in some beautiful periodization plan, go for it, but this is the bare minimum. So as far as incentives, when you get somebody off the pharma treadmill, right, we have a few of you guys already on here, Dylan and Jordan, good job. You guys are going to email in the pictures to Tiger, Ben, and myself, okay, so that we can highlight those both social media within the club. That member is also going to receive a $150 credit on their account that they can use for anything but their membership. Okay, so that could be an additional frequency with you. It could be supplements, it could be geo meals, it could be anything. Okay, and then this part is something that we're going to flesh out, but we want to really highlight you guys. As being the catalyst for change in our communities. We're going to do like a tiered recognition system. So the first person you get off drugs, we want to recognize you as being a primary healthcare professional. We'll probably have it in addition, like on the bio wall. When you get 5 people off drugs, you're going to be a wellness warrior. These names could change. Ben and I were chatting about this over text and it got silly. But the more people, we want to have like clubs where the more people that you help, right, the higher tier recognition you receive. As far as a bonus directive, of course, some of you guys may aspire to train more clients and train them more often. That may not be all of you, and that's fine. But what we're definitely going to need is we're going to need more trainers. As in people you might know or people your clients might know, we want personal training to be the career path for the best and the brightest, right? The reason why people aspire to be doctors or lawyers or anything anymore is mostly from past experience or because they see that income earning, okay? We believe that can be the case for trainers as well. Okay, and it's going to have to come from us to drive that forward. And that's all we got for our presentation today. Obviously, we'll field any questions. If you guys have anything on the resources presented or just in general on how we can execute on this. But we'll leave it with that. If it is to be, it's up to PT, and together we can do it.